All right, thank you guys. Now we move on to the female reproductive system, and we'll talk about, of course, starting with the anatomy of it, and then we end up with the physiology of it, where we talk about how the female reproductive system is controlled by hormones. All right. I noticed in your modules you kind of had trouble, putting together the different stages of the menstrual cycle in order. So we'll kind of go through that in a little bit. And so these are basically the organs of the female reproductive system. So we get the ovaries, of course, that produce. This will be the primary organs. Everything else will be kind of accessory. It sort of assists in the function of reproduction because it produces the ova, the egg cells, just like the testes in the male are the primary reproductive organ because they produce the sperm cells. Everything else is kind of accessory organs, right? It helps out, like the uterine tubes. The uterine tubes, we'll talk about it. That's where fertilization actually occurs in the uterine tubes. And then, of course, uterus is one that sustains the developing fetus until birth. Okay, and then the vagina, of course, is the birth canal, and is also used for copulation. And sperms are deposited high up near the cervix during intercourse, and then travel up to the uterine tubes. Uterine tubes are also sometimes called oviducts, and kind of in the exam I use them interchangeably. I just sort of use whatever just strikes my fancy at the time. Okay, or fallopian tubes. All those are the same thing. Oviducts, uterine tubes, fallopian tubes, the same thing. Okay, so don't be tricked whenever I use any one of those terms. It's referring to the same thing. All right, and then of course mammary glands that produce milk, to nourish the afterbirth neonate. All right. So we'll talk about each of those, of course, talk about the characteristics, and talk about the functions that each contributes to the reproduction in the female. All right. So the ovaries, of course, primary, produce the oogonia, and which eventually becomes the egg cell.
Ovaries don't produce the oocyte?
They produce the oocyte is a stage in the development of the oogonia. Because they start off as oogonia.
So it produces the oogonia.
Yeah, the oogonia, and then the oogonia, the same cells will develop into the primary oocyte, secondary oocyte, and then the secondary oocyte is what is actually released during ovulation.
Oh, okay.
Yeah, and it will be in metaphase too, and we'll talk about that.
That's where I'm confused.
Okay, it's just the different stages of the same cell. Just like you have a sperm cell, that's a spermatogonium, and then
me too.
Yeah.
I just need to read it.
You need to go through it. You can listen to that little cartoon I had in it last time, but pretty much it's the same thing in the female, but the female it's kind of different in many respects to the oogenesis. Okay, because in the female it starts in utero. That's what I'm saying. In the male it starts at puberty. So there's a big difference, and I'll talk about how it starts in utero and so forth and so forth. So after birth, and even in utero, the number of oogonia start to decrease, and we'll talk about that. All right.
So you're born with all the eggs already.
You're born with all the eggs already, and then after that, the eggs start to just go down, and in number, decreasing in number. Until when you reach menopause, they've almost all gone. And you're no longer ovulating anyway, you're no longer having menses and whatnot at that time. So we'll talk about all those stages up to menopause. Like I was saying, everything else is really accessory, apart from the ovaries are the main, the primary reproductive organ in the female. Everything else is kind of helping out. Okay? So the uterine tubes, the uterus, the vagina, the mammary glands, all that accessory. All right? So the functions, of course, of the female is to produce estrogen, the hormones, and progesterone that sustain the secondary sex characteristics of the female. Is, of course, to produce the egg cell. You need to produce the egg cell, which is the ova, all right? And it needs to receive the sperm from the male, and actually in the female, that's where capacitation of the sperm cell occurs. It gives it the ability to fertilize the egg. Okay, and it's because of the secretions of the vagina and the uterus and so forth. It gives it the final ability to fertilize, and it makes the acrosome able to release those enzymes. Okay, so it removes certain glycoproteins from that, during capacitation. Okay, so that's another function of it. So nurturing and also developing the offspring, because it grows in the uterus of the female. All right, so the female takes the bulk of the responsibility for reproduction. Because once the male has deposited, the sperm is done, and then the female reproductive tract has to capacitate, make them able to fertilize the egg, and then produce the sex hormones, the major of which is estrogen, and then also progesterone. Okay, so if you can see, there's a lot more function for the female, okay, reproductive system in reproduction. Okay, the majority of the responsibility is here. Okay, so if I ask about what are the functions of the female reproductive system, we talk about all that. Right, including nurturing the developing offspring. So I like these pictures because they're actual categories, and they actually show you, you see, these will be the fallopian tubes, right? The fallopian tubes, they kind of sort of widen into what is called the ampulla, and then in the end of it, there's the infundibulum, which is fimbriae, which are kind of like finger-like projections like that. Okay, that sort of gather the egg when it's ovulated, after ovulation. There are instances when the egg cell sometimes will develop in the abdominal cavity, or what's called ectopic pregnancy, or sometimes it will develop in the uterine tube. It will implant in there. But in the uterine tube, it's fertile, or sometimes because it can blow up the the abdominal cavity. You could grow to term a fetus developing in the abdominal cavity, but you just have to use C-section to get birth. So it happens, and then you have a full term baby. All right. So the ovaries, of course, the primary organs of reproduction in the female, and these are the uterine tubes, okay, or oviducts or fallopian tubes, whichever you like. It doesn't really matter. Okay. Then there are certain ligaments, and I'll show you another picture that shows them. One of which is called the round ligament. Then there's a broad ligament that holds the uterus in place. Okay, and there are some that also suspend the ovaries, like suspensory ligaments that suspend the you know what I'm saying? Because these organs are located in the abdominal cavity, right here, in the pelvic cavity a little bit. So they need connective tissue to hold it in place. Especially after birth, we will talk about the condition in the female where some of these ligaments become weak and the uterus prolapses into the vagina. It literally drops in there. Okay, it can be surgically corrected. Sometimes if it's very bad, but yeah.
What happens from having kids?
Yeah, when you have had a few kids, in some women, not all the time. Because it just gets weakened. Because one of the things about giving birth is that everything is kind of weakened and loosened in this area to have space for the childbirth. Okay, so that you have enough space. So sometimes in some females, it's not very common, but it can drop into the vagina. And then they have to push it back up, or they have to surgically correct it. Because so those ligaments are very important, and I'll show you another picture. Of course, the uterus is divided into three things, just like the stomach. It's got the fundus up on the top, like the stomach, right? It's got the body, and then it's got the cervix. The cervix is kind of like a tubular, extension of the uterus, and then it's got, the cervical canal and the uterine, lumen form the space within the uterus. Okay, so the cervical canal over here. And then, so this is the It's like the plug that closes the uterus on the external side. So it's external os, and then the internal os also kind of closes the interior part of the cervical cavity or of the cervical canal, right? In fact, when the sperm cell is released at the cervix, there's normally some thick mucus that plugs this hole here. So part of capacitation is the ability of the sperm to release the enzymes, you know, from the acrosome to digest this first to get in. So that's why you need like a billion sperm cells, right? Remember when I said 2 billion in the maximum amount of sperm cells, if you look at the maximum end, it's a 400 million per meal times 5 gives you 2 billion. So you need sperms to digest this. Then of course there's going to be loss of sperm cells during sex, you know, and so forth. Some of it goes in. That's why it's kind of sticky fluid so that it stays in the reproductive tract. Okay? But when the female reaches orgasm, the contraction of the female reproductive tract will help the sperm cells to go out. But you have to first digest this plug on the, because you can't just have that open, you know what I'm saying, and stuff gets up there. It will infect the uterus. Okay? So that's that. And then of course you get the vagina, and then of course the external, which we'll talk about in a little bit. And so here, it's a, you know, you've dissected the skin and some of the fat and connective tissue, and you can see the clitoris, which is almost like the female version of a penis, really, because it's got the same corpora cavernosa, you know, those erectile tissues, same thing, and then of course it's also covered by a prepuce, which is like the foreskin in the male, and part of the labia minora will go like a hoodie, you know, covering the little clitoris. Okay, and then it's got the root, which is formed by the corpus spongiosum as well. You know, just like the male has got those 3 erectile columns, the female also has 3 erectile columns in the clitoris. And the root of it, the crus of the clitoris, will be formed by the spongiosum. All right, and the corpus spongiosum also forms these vestibular bulbs, and they're kind of sort of deep in the vagina. You see how the vagina, I'm drawing it parallel, okay, it's supposed to be like that. And then you have an erectile tissue here from the corpus spongiosum, so that during sex, they also become engorged with blood, and then they start to squeeze the vaginal canal. You see the growing there, which means it will increase friction between the penis and the vagina, okay? And then they contribute to orgasm. So that also becomes erect in the female during sex, and it makes the vaginal canal thinner, or it squeezes up on that, and then on the penis. And then the labia majus protects the vestibule, which is the part where the vagina opens, the vaginal orifice, and the urethra opens. That part there is called the vestibule. And then there's a mound of fat on the top, just above the clitoris, called the mons pubis. Mons is a mountain, and it's right on top. All right. And all these external, you know, organ genitalia for the female, like the vulva, you know, the vulva is the name for all of them. Vulva is like covering or wrapping. So it covers and protects the opening of the vagina and the opening of the urethra, right? So they're called vulva, all those, the labia majora, labia minora, the vestibule, all those organs on the outside. They're also called pudendum. Pudendum means embarrassed or to hide. So those, like the labia majora and minora, they close up and protect the female reproductive organs on the outside, the external genitalia, right? And then the crack in the middle is what is called the pudendal cleft. Okay, you know, when the labia majora are together in the female, right? And then of course the vagina has got, because the cervix dips a little bit into the vagina, and it creates the fornix, which is the posterior fornix over here and the anterior fornix up there, all right, and then the vaginal canal. Okay, so that's why, you know, if those ligaments are all loosened up, the uterus can drop into the vagina. the prolapse of the uterus, because it's already kind of going in a little bit, and the vagina kind of surrounds it. So it's like a dome-shaped. So that's why the fornix is called fornix. Goes in there, all right? And then this is a diagram, of course, showing the clitoris over there, and then of course the opening of the urinary system is separate. In the male, it's the same opening. The urethra opens to the reproductive system, opens to the urinary system. But in female, it's different. You've got a one for the digestive, the anus, one for the urinary, the urethra. It opens right in the vestibule, just above the vagina. And then, of course, the vagina is another opening. That's what's used for, for as the blood come out and for copulation. All right? So those are the differences. Okay. So the ovaries, like we said, they are the primary reproductive organ, and they're suspended in the abdominal cavity here. And so these suspensory ligaments are important, right? So it's held in place by the suspensory ligaments. The suspensory ligaments kind of sort of suspend it. So here are ovaries, and then it will attach to the lateral wall of the abdominal, of the peritoneum, really, actually. The lateral wall, so it's kind of suspends. You know, suspension is when you kind of suspend from the top, all right? And then you've got the fallopian tubes, and then you've got the uterus, and then this is like that. And then you've got the cervix here, and then the vagina goes like that. Okay. Okay. So so then you've got the suspensory one over there, and then you've got kind of like the round ligament that goes around like that, and attaches to those to the ovary, and also attaches to the uterus. And the broad ligament covers all this, and it attaches to the fallopian tubes. It attaches to the ovary. So the broad ligament is like a broad, that holds the sides of the uterus in place. Okay, and then of course the ovarian ligament kind of goes to the side like that. Okay, it goes to the side, and the broad ligament. So you've got those. The broad ligament also attaches everything, like the fallopian tubes, and the uterus, okay, and the ovaries too. Okay, but these ones are strictly on the ovaries. One is on the side, the ovarian ligament, and the suspensory ligament is on the top, kind of sort of attached to the lateral side. Okay, the visceral peritoneum. See, the peritoneum has got two layers. The one that's close to the organs, which is the visceral, and the parietal, which is on the outside. So that one kind of sort of covers all these organs and the ovaries. Okay. When a female does a tubal ligation, you need two physicians. One who's the anatomist who will actually identify the fallopian tube or the oviduct. Then the other one who's the surgeon who comes and cuts. Because they want to be sure they're cutting the correct thing. See, it can be confusing with all these ligaments all over the place, and then you're also trying to identify the actual fallopian tube. You know what I mean? So you don't want to cut and like get the wrong thing. We've seen the tunica albuginea again, which comes from the the peritoneum and is divided. That covers the ovaries. So you've got the ovaries like that. All right. So you have the cortex kind of on the outside. Okay, and then that's where the cells are developing, the oogonia and so forth. And then you've got the medulla, where kind of sort of in the middle, where the lymphatic vessels come in, the blood vessels come in to supply the ovaries, right? So the ovaries got those two layers, just like the kidneys, the cortex and the kidneys have the same cortex and medulla. Okay, excuse me. All right. So just know the basic ligaments that hold the ovaries, and also the structure of the ovaries in the two layers, the cortex and the medulla in the middle of the blood vessels. And of course the tunica albuginea, which we also saw in the male, it covers, it's a connective tissue covering the ovaries. Okay? So that's the ovaries, the primary. And then again, now this is one showing the suspensory ligaments. You see how the suspensory ligaments kind of sort of goes on the top and suspend the ovaries like little balls like that, like a pendulum. And then of course the broad ligament is attached to the sides of the uterus, and it's also attached to the fallopian tubes, and it's also attached to the ovaries. So it kind of attaches all of them like that in place and keeps them in place. And then the round ligament kind of goes on the side like that, okay? And then the ovarian ligaments will be kind of sort of like that. You see, it's attached to the ovaries like that, and to the side. Suspensory suspends from the top. All right. Okay, so you can see the broad ligament, how it's attached all the way to the sides, and it's attached everywhere, and then to the and you can see, and then this broad ligament like that, and it attaches to those, and it kind of drops like that. It attaches to the sides of the uterus, it attaches to the bottom of these fallopian tubes, and it also attaches to the ovaries. So it kind of holds everything in place. Then you have the round ligaments, okay, and you see the ovarian ligament kind of holds it to the side like that. You see the ovarian ligament over there, and it's holding the ovaries in space. Actually, there's another one on the sacrum. You see how you have another ligament that attaches the uterus. So this is the uterus, and this is the vertebral column, and this is the sacrum, right? And vertebral column. There's another ligament that attaches to the sacrum like that. All right? On the back. So you just hold everything in place, and it's held in place. All right. All right. So now the oocyte development or genesis, it has to accomplish two things. Okay. So the same thing that happens in the male, where you start off with spermatogonia, and then primary spermatocytes, primary, secondary spermatocytes, and then spermatids and so forth. The same thing kind of happens in the females too, where you start off with the oogonia, all right, and then you have the primary oocyte, then the secondary oocyte, which is now haploid, all right, and the secondary oocyte is what is ovulated. So you want to produce that haploid cell, but in the females, you also want to produce the follicle. The follicle will be the cells surrounding the egg cell, surrounding the primary oocyte, secondary oocyte, okay? Because that becomes the corpus luteum. You see what I'm saying? The follicle. So you are trying to develop the egg cell, the oocyte, and then you're also trying to develop the follicle. Okay, so those are the two things that are happening at the same time. Here I'm going to sort of talk about them, one first, you know, and then the other second, but they are happening at the same time. You see what I'm saying? Because the female produces the corpus luteum, which produces a whole bunch of progesterone and estrogen, which sustains the uterus lining. Okay, you see what I'm saying? So you have it's like that's your egg inside, and then around it you have all these cells that are surrounding it. Okay, that form a big cell like that. That is then filled with fluid here. Okay. So that's what you need. So this will be the antrum, that's called fluid, and you've got your egg cell right in the middle. So the egg cell is released with a few cells surrounding it, and then you're left with the corpus luteum. So you are trying to do two things here for oogenesis. Okay. So I'll talk about them in first one. So in utero, like I was saying, you know, around 4 months of gestation, when the female fetus is about 4 months, there's about 5 million oogonia in the ovaries. 5 million, okay? And at birth, it kind of goes down to like 400,000, okay? They start to degenerate, you get about 400,000, and they start to sort of divide, you know, the meiotic division, the first meiotic division, and it is arrested in prophase 1, okay? Then the child is born, the female child is born, right? And then after that, they reach puberty, okay? Where, you know, from puberty to the end, you have about 400 that will be released, okay? So will actually be ovulated and have a chance to be fertilized, okay? So from 5 million, you go to 2 million at birth. And then by the time you reach puberty, with about 400,000 of these oocytes, right? And you know, they then become secondary oocytes that are arrested in metaphase 2, and you know, just before ovulation. Just before ovulation, when you have that LH stage, that oocyte arrested in prephase 1 will then continue the first meiotic division, so that it's now a haploid cell. Okay? And then it will start the second meiotic division, but it doesn't finish it. Okay? And then it's a secondary oocyte that is ovulated and is arrested in metaphase 2. Okay? That is, it will be arrested somewhere in the middle of the second meiotic division. You see, meiosis occurs. The first division is a reductive division where you halve the genetic material to haploid. Then the second meiotic division is actually mitosis. It just increases the cell numbers. Okay? So just before ovulation, because of the LH stage and all those things, it causes the primary oocyte that is arrested in prophase 1 from birth, okay, to then divide and finish the first division for meiosis, and then it's arrested in metaphase 2, and it's now a haploid cell, egg cell, and it's a secondary oocyte. It will finish up the second meiotic division only when it's fertilized. If it's not fertilized, when you have menstruation, you are releasing a secondary oocyte that is arrested in metaphase 2. You see what I'm saying? So you start off around the 4th month of gestation with about 5 million at birth, 5 million orgonium that kind of sort of develop, start to do the meiotic division, and then is arrested in prophase 1. So it doesn't even complete the first meiosis. Okay, so at birth you have about 2 million of them. Then by the time you reach puberty, around age 12, 13, 14, depending on the female, then you have about 400 of those, 400,000 left. Okay, of those 400,000, only about 400 of them ever get ovulated and will develop. Okay? And another difference that I want you to see here is that with the male, with the female, when it divides, most of the cytoplasm and all the organelles go to the egg cell, and then you produce a polar body, okay, which is just a cell that carries the genetic material, just so that when it's halved at the beginning, okay. And again, the polar body could divide if it wants, but you know, the egg cell has all the goodies, right? Why? All the in the male, we saw that one spermatogonia spermatocyte can produce 4 sperm, right? But in this case, the other 3 cells are polar bodies in the female, and all the cytoplasm and all the organelles go to the egg cell. Can you imagine why that is? In oogenesis, why would all the egg cells, when the cell actually divides and finishes all these meiotic stages, one of them is a polar cell and the other one is the egg cell, which is big. It's got all the organelles, mitochondria, whatnot, and then the cytoplasm. Why is that? Why do you think that's necessary? Think about what happens at fertilization. At fertilization, well, you have the chromosomes to 23 still, but the cytoplasm, all the organelles, they go to the egg cell, and the other one is just a little polar body that just a very tiny cell that sometimes just degenerates, or it could divide to form 2 more polar bodies. But you know, okay, when fertilization occurs, where is the egg? It's in the fallopian tubes, right? It's not attached to anything, and it's not getting nutrients from anywhere. So where is it going to get nutrients? So the first week of life, the cells are dividing and increasing in number, and they're getting all the nutrients from the egg cell. You see what I'm saying? So that's why when you in oogenesis, the one cell takes all the organelles, takes all the cytoplasm, and all the nutrients go there, because the first week of life is not attached to the uterus, it's not getting anything. So you see, that's another difference with the oogenesis and spermatogenesis. Okay. So this is what happens here, and that's we are producing the oocyte, the egg cell. Okay. I haven't started to talk about the follicle yet, because the follicle is what that becomes the corpus luteum. Okay. So we need to do that too, and this is happening at the same time. You know, actually, when big animals like the cow ovulates, the cell grows so big that you could put your hand through the anus of the cow, and you could feel what's called the cumulus forus. It's a big ovary. It grows very big. Even in the human, it grows really big because it's surrounded by all the cells, and the egg cell itself is getting all the nutrients and stuff. Have you seen when they do in vitro fertilization? They actually inject the tiny little sperm into the big old egg. You see what I'm saying? Because the egg is got all the nutrients. Okay, so that's the reason why. So oocyte development and fertilization. Okay, we said the secondary oocyte, when it's released at ovulation, it is arrested in metaphase 2. So that means it has started the second meiotic division, but it doesn't complete it. The only thing that will make it complete is if it's fertilized. If a sperm cell enters, then it will stimulate it to divide. Again, it will form a small polar body, and the egg cell has got all the nutrients, okay, and all the organelles. Okay, so ovulation, yeah.
Polar body is the reason for like the egg cell feeds off the polar body. It's like nourishment. I'm confused by that.
No. Okay, so let's look at just a cell. A regular cell, let's say a sperm cell, right? Remember the sperm cell divides like that? So this is meiosis 1. So now this is 46, this is 23, this is 23, right? Okay. And then the second meiotic division, you form 23 chromosomes. Okay, so this is what is called the secondary oocyte. This is the primary oocyte or primary spermatocyte, right? Okay, and then and it's still 23, still 23. So normally, like for spermatogenesis, you produce 1 sperm cell here, 2 sperm cells, 3 sperm cells. But in the female now, because we gotta have all those cytoplasm organelles and everything into one, when it divides in the female, this is big and this is tiny. This is what I'm calling a polar body.
Okay.
PB is polar body. Okay, this polar body can also divide to form 2 small polar bodies, or sometimes it just degenerates. Okay? Now, this egg is going to also divide, right? Just like this polar body can also sometimes divide. So this egg cell is also going to divide the second meiotic division to form the, so here, here it will be kind of like a primary spermatocyte. It's arrested in prophase 1 right here, and then it finishes it up. And here, it does the second meiotic division, and then you have a big cell like that. Okay? And then it will form a polar body. This polar body will just be inside here. Okay?
So it divides because it has to.
It divides because it has to, because that's what meiosis does. Okay? Because of the chromosomes. And the first one, this will contain the other 23 chromosomes when they are halved.
So polar body really isn't important. It's just a part.
It's just a part of the division process, because when a cell divides, it forms 2 cells.
Yeah. Okay.
Yeah. So instead of equally dividing the cytoplasm between the 2 cells, you put all the cytoplasm in this one egg. That's going to become the egg cell. So that's why there's lots of wastage, right? Remember, I told you the number decreases from 5 million at the 4th month of gestation, all the way to 400,000 by the time you get to. So when they're dividing, this is what's happening. The other ones, the other 3 cells are becoming polar bodies. You know what I'm saying? That are just, they're very, very tiny cells, actually. They don't even have any cytoplasm in them, okay? Their purpose is
polar bodies can't be fertilized though, right?
No, they can't be, because they're not even real cells. You see, they don't have cytoplasm at all. They don't have any organelles in them. It's not like a cell. Because all the organelles go into what is going to become the egg cell. Because come first 7 days of life, it will be living off of those nutrients. You see? So that's why in the females, it goes down. The number of egg cells goes down. And even at ovulation, you get like maybe 20 or so egg cells starting to develop, but one of them becomes dominant. And then it will cause the other ones to kind of, regress, and they are just digested. So every time you lose about 20 or 40 every month. So by the time that's why you then reach menopause, because they are finishing all the time. You see what I'm saying? So that's what happens. So one large ovum is formed, and that's what becomes the functional gamete. The other polar bodies are just there because of the division process, which produces two. And for sperms, that's why you have like a bunch of them, because all 4 of them become sperm cells. See what I'm saying? Because you need a lot for fertilization. I mean, if you're going to have 2 billion per ejaculate, that's a lot of sperm cells. Okay, so fertilization is actually when the egg cell and the sperm cell unite. And then once you have a 46 chromosome zygote, then fertilization is finished. Okay, so the developing embryo, the developing offspring inside is 2 stages, from like the fertilization from the zygote stage all the way to the end of 8th week is the embryo stage. From the 9th week to birth is the fetus stage. Okay, so that's what that is. So just be able to define fertilization, of course, and just know what happens with the oogenesis. All right, when you're forming the egg cell, at each division stage, you form a little polar body and a very big oocyte. That is all the goodies and all the organelles. All right. Okay. Good. Okay, so this is the same part like we did. This is production of the oocyte, the secondary oocyte, right? So just like in the male, this is what's happening. You've got a bunch of oogonia that will divide. One of the cells remains as oogonia, so that you continue to have a cell line, and the other one becomes the primary oocyte, right? And it's got 46 chromosomes, all right? And then it goes through the first meiotic division, which is reductive division. You see how small this cell is? This is a polar body, and this is a big one. So this polar body sometimes can divide, sometimes it just degenerates into nothing, and then it's just digested off. Okay, but this one is now the secondary oocyte, when it's got 23 chromosomes, just like in the male. Okay, but this time the other cell is knocked off as a polar body, instead of becoming another sperm cell or an oocyte. Okay, you only get one cell that gets all the organelles and the cytoplasm. All right. So the secondary oocyte will then go through, the second meiotic division. All right, and it doesn't complete it. It is then arrested in metaphase 2. Okay, you see what I'm saying? And it only finishes the second meiotic division only if it's fertilized. If it's not fertilized during menses, you release a secondary oocyte that is arrested in metaphase 2 with the menstrual flow. Okay? You see, because only if it's fertilized, you see, when it's fertilized, do you continue the metaphase, the second meiotic division. Okay? So if I ask about the production of the oocyte, okay, then you talk about that. Primary oocyte, okay, secondary oocyte, and then the secondary oocyte at ovulation is arrested in metaphase 2. Then it's fertilized. If it's fertilized, only if it's fertilized, then it completes metaphase, the meiosis 2. And then it becomes a zygote with 46 chromosomes. And then life starts. Life is started then at that time. Okay? So this is oocyte production. I mean, production of, the ova, the egg cell, and fertilization. All right, to complete the process. All right. Remember, I told you there's 2 things happening inside. Now we've got to produce a follicle. The follicle is those cells surrounding those, starting with the primary oocyte. You see what happens when the primary oocyte is developing, is doing its thing, is doing its normal division. First of all, it's surrounded by a layer of flat granulosa cells. Okay, remember squamous granulosa cells? The cells surrounding the egg cell are called, granulosa cells. So when it's the first when it's a primary oocyte, it's called, and it's got flat granulosa cells or squamous granulosa cells surrounding it. One layer of those granules, it's called the primordial follicle. Okay, so the primary oocyte plus one layer of flat cells like this. Okay, and then the egg cell is in the middle. That's what is called the primordial follicle. Okay, so now it's the development of the follicle. Okay, that's what I'm focusing on. Then those cells, okay, will become cube. They start to grow. They become cube granulosa cells. Then it's now the primary follicle. Okay. Now, the primary follicle, it's inside of it is still the primary oocyte. It's still arrested in prophase 1, okay? No, we're talking about the cells on the outside that become the corpus luteum now. You see what I'm saying? So, and I'll show you a picture of both of those processes occurring at the same time. Okay? So, now, when that cuboid, the layer of granulosa cells that have now become cube, they start to increase the number of layers. Okay? And you start to get some fluid-filled vesicles occurring inside of it. It's now the secondary follicle. Okay? It's now the secondary follicle. Okay? And then, when the more of those granulosa cells continue to grow and continue to surround the oocyte, and it goes big like this, and you've got the primary oocyte in the middle here. Okay? It's still arrested in prophase 1, right? And then you've got all these cells. All these are cells, okay? Cells. All these are granulosa cells growing. When you have those fluid vesicles have joined to form one big cell, and this is filled with fluid, and it's called the antrum. That's when it's called the mature or Graafian follicle. Okay? It's a mature follicle, and it's one that will cause like a bump on the ovary because it's gone so big and fat. Okay? Now, just before ovulation, when the oocyte, that's when you have an LH goes up, LH, which is luteinizing hormone, it goes up, and it will cause the primary oocyte to finish. But all these cells have developed, the follicle is all developed around it. Okay? And just before ovulation, it will start to divide the first meiotic division. That's when it's arrested in metaphase 2. Okay? And when it's released, the secondary oocyte now at metaphase 2, when it's released, it's the secondary oocyte and it's still got granulosa cells surrounding it. Okay? Like that. Those are called, that's the corona radiata right there. Okay? Okay? So that's the development of the follicle. Also, what's happening is that, and I'll show you in the next slide, the egg cell is covered by what's called the zona pellucida, all right, which is a layer here in the primary follicle. When they become cube, okay, and then as it continues to grow, as the cells continue to grow, there is another layer that goes on the outside called the thicker externa and thicker interna. Okay, it will form two layers when it's now the secondary follicle. So you have a layer here, and then you have called the thicker externa here, and then you have the egg cell surrounded by the zona pellucida. Okay, like that. And then you have the fluid-filled antrum here. And that's the mature follicle. Okay? So you have flat granulosa cells surrounding the primary oocyte, and then the primary oocyte also has the zona pellucida. Okay? And then they become cube, those flat cells, and it's now the primary follicle. So primary follicle only has flat squamous granulosa cells on it. And then the primary follicle has got the zona pellucida surrounding the egg cell, and then the flat cells are now cuboid cells. They're now cube, they're growing. And then the granulosa cells continue to form many layers around the egg cell. Okay? And then you start to feel fluid in those cells, fluid pockets. Okay? Then another layer on the outside called the theca will develop. And the theca has got two parts, the theca externa and the theca interna. And then that fluid that was accumulating all over the place joins to form one fluid vesicle, and that's now called the secondary follicle. Okay? And then when everything is all united and it's got the two layers on the outside and the one layer, the zona pellucida on the inside, and then the fluid-filled antrum is one, then it's called the mature follicle. All right? All right, stop. So that's that. So all those follicles that were growing around will develop into this corpus luteum when the egg comes out. You see, this part where the egg is located is called the cumulus mass. Okay? And this is the part that's ovulated out. And then all these remaining cells, you see the theca externa and the theca interna, and then the zona pellucida is this white layer. Okay? This remains and it becomes yellow. It becomes a yellow body called the corpus luteum. This means yellow. Luteum means yellow, and then corpus means body. So it's a yellow body. Okay? So then this produces estrogen and progesterone, which maintains the uterus lining. Okay? So, and then you can see here in the ovary, all right, that's kind of growing a little bit. I'll just try to show you the second part so that I can leave it a nice spot. Okay, I don't want to leave it in limbo. Okay, so there you've got those cells developing, follicles, and one of them, which is dominant, then it forms the mature follicle where you get the release of the egg cell. Okay, so follicle development. So as the egg cell is dividing up, so the follicle is dividing up. Oh, there you are. Oh, I saw you. All right. And remember those eggs, the cells that are surrounding the egg cell, right there. That's what's called the corona radiata because it looks like a crown. Okay. And this is what is ovulated, and it's now secondary oocyte on metaphase 2. Okay? And then the follicle becomes the corpus luteum. The corpus luteum produces the hormones, estrogen and progesterone. All right? So that's what happens to the follicle. All right? So now this is the two processes together. This is where I would stop. Okay, so what you have is a primordial follicle. You have the primary follicle the primary oocyte arrested at prophase 1, and it's surrounded by flat granulosa cells, and it's called primordial follicle. Then the primordial follicle will start to have these cells growing, and then they become cube, and it's now called the primary follicle. And during that same stage, you get the zona pellucida. You see this white layer covering the egg cell? And then, so that happens in the third stage. And then you get more granulosa cell layers occurring. Okay? Then, on the fourth stage, what do you have? And this is still prophase 1. It's still arrested in prophase 1. It's still a primary oocyte. Okay? Then, you start to get another layer on the outside called the theca, which is formed by the theca externa and the theca interna. And then you can start to see these fluid-filled vesicles. In the meantime, the granulosa cells are growing around. Okay? Then it becomes a mature follicle when all the fluid-filled parts unite to form one antrum. Okay? And then you have this part here with these cells is called the cumulus mass. This is what is released. And then these other cells become the corpus luteum. You see? And the secondary oocyte now at metaphase 2, because the ovulation LH will cause the primary oocyte to finish the meiosis 1. Okay, and then it will go to meiosis 2, and then it stops at metaphase 2. Okay, then this what is called corona radiata, because it looks like a crown. You see the cells, the granulosa cells surrounding the egg cell. Okay, and then this follicle that remains becomes corpus luteum. Okay, and if the egg is not fertilized, this is released as the secondary oocyte at metaphase 2, and the corpus luteum degenerates into what's called the corpus albicans, from albino, because it becomes white and then it degenerates. Okay, so those are the two processes happening at the same time: follicle development, which becomes the corpus luteum, and then also the primary oocyte, which becomes the egg cell. Okay, with the 23 chromosomes. So those are happening at the same time, and that's the whole process. Okay, so next time we'll start from here. Okay, guys. All right. Thanks so much. I appreciate it. All right. So next time we'll start from here.